All right. So, hi and welcome to the show, Dr. Lauren Castle. How are you today?
I'm great. How are you?
Awesome. So, I don't know if you heard previous episodes of the show, but I like to have my guest not interview, but introduce themselves. Just tell us a little bit about your background, where you grew up, where you went to school, anything else you want to share.
Sure. So I grew up in Monroe, Michigan, a little town just south of Detroit. That is where I first kind of fell in love with pharmacy. So I started working for an independent pharmacy while I was still in high school as a technician and knew that that's just what I wanted to do with my life. And so I went to pharmacy school at Ohio Northern University in Ada, Ohio, and graduated from there in 2013. While I was also in school, that's where I met my husband. And so I moved to Ohio. And that was definitely a turning point because I had to get a new internship while I was still in school. Wasn't really sure where I wanted to work, but I thought maybe it would be a good chance to try something new since obviously I couldn't be at the same independent that I had worked at. So I ended up working for the biggest company in the world since that would be, definitely a big change to get exposed to something new and ended up loving it. So that was definitely a change from what I thought I would be doing when I was 16, working in an independent to then 9 years later still being at Walmart currently.
Oh, okay.
So that was sort of my pharmacy journey. And it's been great so far. We've kind of moved back and forth between Michigan and Ohio. So we spent some time back in Michigan during the water crisis in Flint. And so that was a time that I really started kind of getting into functional medicine, both for my patient's health as well as personally for my husband and I. We were working through some different health issues that he was having, and we thought we were doing everything right. Eating right, working out, trying to sleep, and nothing really seemed to be getting better. So we discovered functional medicine at that time, and it was really life changing. So at that point, I was like, well, this is the future. Like, this is what I want to do, and figure out a way as a pharmacist to incorporate this into my own practice. And so I had been looking at online degree programs for a while, and then came across one for the University of Western States, where they have a master's in human nutrition and functional medicine. So it was the perfect fit for me, and I completed that program in 2018. And yeah, in the interim, started kind of talking about functional medicine and teaching other pharmacists about it because I was really passionate, and found that there really weren't a lot of resources out there around functional medicine for pharmacists. So I created a little Facebook group to go along with one of the talks that I was giving so that we could kind of all stay in touch after the conference was over. And that little group quickly grew into 500 pharmacists. And so as it continued to grow, the next talk that I did, I took that opportunity to actually start a website for the Functional Medicine Pharmacists Alliance, so that there really would be a dedicated resource for pharmacists that are entering this field. And that has also continued to grow. So we're up to 1,300 members now, which is
Wow.
really exciting, that so many pharmacists are getting interested in functional medicine. And so I'm really excited for 2020 and everything that this year will have in store for the organization, including a new website launch that will be coming up.
Wow, awesome. I commend you for all of those feats, really. I graduated in 2013 as well, so
Yeah,
that's around the same time frame.
that's awesome. Which school were you at?
I was at St. John's University in New York.
Awesome. Very cool.
Yeah. So this functional medicine program that you attended, was it more geared towards doctors and was it online only, or did you have to travel and actually attend lectures?
So the program that I did is a master's degree in nutrition. That is primarily what it is. And then there's content that's provided by the Institute for Functional Medicine since the school has a partnership with them. So it is 100% online. The school itself is actually one of the oldest chiropractic colleges in the US, based out in Portland, Oregon. And so they have a couple different online degree programs as well as in-person programs that are all around like allied health sciences and the nutrition program, obviously. So the program did not require me to travel out there for any type of classes or courses. I did go out there for graduation though, just because I really wanted to meet some of the classmates that you would get to know over the 2.5 years that it took me to complete the program. There's really a mix of students in the program. So about half of them are clinicians already, whether it's pharmacists, doctors, chiropractors. A lot of chiropractors that are in school at that program do a dual degree with the nutrition program. But then the other half were non-clinicians. So they may have been people with a science background who wanted to study nutrition. But the goal of the program is to prepare you to be a nutritionist. So after completing the program, you have all of the curriculum needed to sit for the Certified Nutrition Specialist exam. After you get the 1,000 hours of practice in nutrition that you need to be certified. So that's one pathway that a lot of people take. But certainly if you already have, a professional practice, you may or may not have to go after the credential itself. For me, I'm currently working towards it, but I took some time off after school. Like I didn't immediately jump in and start studying for the exam and doing all my hours. Partly because I was still working full-time in pharmacy practice, and so I didn't really have those nutrition hours that I could accumulate. But now my career's changed a little bit, and I've actually been able to do a little bit more with nutrition, and I'm working with a supervisor for my hours to accomplish those as well.
Okay, so what are those hours? Are they like one-on-one sessions, assessing somebody's nutritional status, or what is that exactly?
Yeah, so there's a couple different ways that you can get the hours. You can do a certain percentage of your hours through basically observation. So even if it's virtual, it doesn't have to be in person. If my supervisor is seeing a patient and I'm just observing and I'm, following along with what they're doing and how she's assessing the patient and what the plan is that they're working up or what the follow-up is, you can have some of those hours from that type of practice. And then the others would be where you're actually coming up with the plans and actually doing the assessment. You look at all different types of disease states. You look at preventative versus treating someone who has an active disease state. Kind of just the whole gamut from start to finish.
So, so is the goal at the end of this practice to become a practitioner where you would see patients one-on-one and help them with their medications and their nutrition and help them with their disease state, essentially?
So it can be. For me personally, my motivation for going through a master's program was quite a bit different than I think most people's would be. For me, back in 2015, when I started looking into programs, it was really about having kind of that expert knowledge base when, for functional medicine being so new, just saying, oh, well, I'm certified in this or I have, a certificate in something wasn't really translatable. So if I put that on a resume, unless you were already in functional medicine, you probably wouldn't know what it meant or if it was prestigious or not. So for me, I really wanted something that was very translatable to anyone in healthcare or not in healthcare. So that was why I specifically went after a master's program. The nutrition piece of it really is just more of a personal passion rather than even being able to practice. Because currently in the state of Ohio, they have more strict laws than other states. And so I can't actually practice as like a dietitian. And so for me to be able to see patients and design like a nutrition plan, I would really need to more likely refer someone to a dietitian. So it really depends on the state that you're practicing in, what you can do with a master's degree in nutrition and even as a certified nutrition specialist. But for me, it's still having that knowledge and also the type of job that I have and the types of companies that I work for It's about being able to provide nutrition education on a larger scale versus necessarily having one-on-one private clients. So I'm looking at how can I work for a grocery chain and help implement nutrition initiatives on a much larger scale. And so to do that, having the master's degree and the certification in nutrition really sets me up to be able to do those types of activities.
Wow. Well, let me dissect that a little bit. So, first of all, you mentioned that you have a supervisor with whom you can document your hours. So, how do you find a supervisor? Is that somebody that you were matched up from your program with, or did you find your own supervisor?
So there's a couple ways that you can go about having a supervisor. They are already CNS credentialed. So you can find one through the CNS program. They can actually provide you a list of people that are taking on new students. And then for me, I actually knew her personally. So it's Lara Zakaria, in case anyone is wondering. She's also known as the foodie pharmacist, and she is absolutely brilliant. So it's great to be working with her on some of those hours.
Yeah, I'll definitely write her down, maybe look her up for the next podcast.
Mm-hmm.
Okay, so, and then you also mentioned some challenges that you feel pharmacists or even people that have a master's in nutrition may face in becoming practitioners. There's probably a lot of legal verbiage and us not being physicians, not being able to treat, diagnose, or prevent anything.
Mm-hmm.
So how do you foresee kind of getting pharmacists into this functional medicine fold and allowing them to have a kind of autonomous look and input on their patients?
Yeah, so that's definitely a really big differentiation between practicing functional medicine and practicing nutrition or dietetics. So when you're practicing functional medicine, there will inherently be a very large component of that that will be nutrition based. Because ultimately that's kind of the foundation of functional medicine is that food is medicine, it's connection, it's information, and we know that a lot of disease begins in the gut. So what you eat makes a really big difference in your overall health. That said, there's still a lot that you can do with most patients as a pharmacist talking about nutrition. So you don't have to go in and necessarily prescribe down to the macro and micronutrient level of exactly what that patient should be eating and prescribe out their food that they're going to have for every meal for X number of weeks. What you can do is provide more generalized guidance in something that's not necessarily individualized to that patient. So let's say you want to recommend an elimination diet. That's something that you can provide resources on and talk them through how to do it, and then kind of experiment with those foods that they might not be able to tolerate, versus trying to really prescribe, like I said, every single food that they're going to put in their mouth for the next 21 days. So as long as you have kind of that step back approach where it's more generalized information, it's okay to talk about healthy eating. If you do have a really complex patient, that may be something that you say, hey, I want to partner with a dietitian or a nutrition specialist to help you with this food piece. Some patients are going to be more independent with it and can really get in there and kind of experiment. Others are going to need more hand-holding and really diving into it. So it just depends on the patient, depends on your comfort level as a practitioner.
So do you see this as a role that retail pharmacists can have as a kind of part of their counseling and MTM strategy? And
Mhm.
also, do you see this as a reimbursable thing, or is this something, obviously it's going to take more time. So this is going to be taking time away from filling prescriptions to go and talk to them, and it's going to be more than like a 5-minute conversation, possibly,
Mhm.
leading to half an hour or however long. So how do you see this fitting into our current model or expanding possibly?
Yeah, so I definitely think that it's something that pharmacists can do even in a retail setting. Um, Step one is whenever you're going and counseling a patient on their medication, you can very easily look in their cart and see what they're shopping for. So I can't tell you how many times you have a patient with diabetes who's picking up their insulin or picking up their metformin, and you see exactly what they're eating. You don't even have to sit down and do a 3-day nutrition diet study and journal and ask them to track everything. You can see their groceries for the week. So it's very easy to have a conversation and just kind of spark that curiosity to say, what's your understanding of the impact on food on your diabetes? And use those open-ended questions, use that motivational interviewing to kind of open up the conversation and see what they say. I think a lot of patients really don't understand how powerful food choices are. So for patients with diabetes, just by taking a more lower carb approach, whether it's paleo or keto or Whole30 or ketotarian or whatever approach it might be outside of the standard American diet, it's probably going to have a really positive effect on their diet. So just starting those conversations and encouraging them to, eat a little bit of a lower carb lifestyle is probably going to have a really big improvement on their diet. So I definitely think that there's quick ways to help kind of push patients along in that direction at counseling. And then secondly, if it's going to become something that's reimbursable, again, it kind of depends on how you want to look at it. I think it's a great opportunity if you have a patient who maybe has a CMR that they're eligible for, that you can take that type of reimbursable service and just integrate in some of these additional counseling points and kind of talking about diet or doing a functional medicine workup on them that's very brief. So you can get a more detailed timeline and patient history. You can kind of map out some of the dysfunction that you might see and just include that in with other services that are reimbursable if you're in a more retail setting. Now, if you have an independent pharmacy, you can set up your own consultations however you'd like to and charge cash. So there's a lot of functional medicine practitioners that completely issue the entire insurance model and just do cash-based consultations. So that's an option as well. You can also do incident to billing if you have a provider that you can work with or a collaborative practice agreement. So there's pharmacists that are embedded in physician offices that can bill for services in that way. And then lastly, even as a consultant pharmacist, there's a lot who are kind of branching out and trying different ways of consulting with patients, not in a pharmacy setting, not in a physician setting, but just completely independently on their own. And so again, you can kind of be able to just charge at a cash rate what you think would be a fair price.
Yeah, that makes sense. So, I mean, a lot of other functional medicine practitioners, whether they're pharmacists or not, that's how they set up their practices because a lot of the testing that they may want to do is not covered by insurance anyway. A lot of the treatment that they will prescribe won't be covered by insurance. So
Mm-hmm.
it's mostly an out-of-pocket practice model right now. Do you see that changing and maybe being incorporated into an insurance model down the line?
I think it depends. Some insurance plans, you can kind of get a little creative around trying to bill things. A lot of times, it ends up not really being worth the time invested to have to go through all those hoops. But at the same time, there's also a lot of changes happening in the insurance industry where there's alternatives to insurance that will cover functional medicine and alternative medicine services through more of a cost sharing model. So I think that overall, as people become more in control of their health and their health decisions, that there will be ways to kind of opt into these alternative models so that you can still have better coverage and make it more affordable. And I think pharmacists are a fantastic way to help do that. So certainly if you're seeing a physician, they're going to be charging top dollar. A pharmacist still should be reimbursed fairly for their services, but it could be a much more affordable rate than what you might have to pay for a physician. So I think just like we're trying to do in a typical insurance model and kind of bridging that gap between patients and their physicians or their specialists, I think pharmacists will be able to fill that role as well and being able to have more frequent follow-up with patients.
Mm-hmm. So, and now you also mentioned in your particular case, since you're working with a supermarket chain, how can you be of service on a higher level with your nutrition knowledge and, trickle that out to all the patients that you're serving?
So, I think it really depends on where you are. So I always tell people start where you are. In the type of role I'm in now, I have 10 pharmacies that I help oversee. So some of my stores are doing really amazing things with point of care testing, and we do wellness days, things like that, where you can actually, check someone's blood sugar, check their cholesterol panel, and talk to them about their numbers and kind of tie it in with other offerings in the store, whether that's a vision screening for their eye health or whether it's nutrition and kind of just giving them some healthy recipes or a shopping list, that talks about the value of really fresh foods ultimately. There's a lot of things that you can do. And so I think it's just taking those little steps and then also living it out in your own life. So anyone who knows me knows that this is something I'm passionate about. They know that I live that lifestyle every day and that I help try to encourage them to do the same. And so I think that really speaks volumes, and it helps motivate and encourage people to start taking those steps themselves.
So how did you step into that role? It sounds amazing. And who performs all those services? Is it all pharmacists, or is the nutrition counseling done by somebody else? How does the whole setup work? And how are you involved in designing and implementing it?
Yeah, so the role that I'm in right now is called a market health and wellness director. This was sort of like my goal whenever I first joined the company to step into that role at some point in my career. And so 5 years after graduation was kind of like my goal. And that is actually what happened. So really just being a really involved pharmacy manager, making sure that I was running my store to the best of my ability and finding success with my patients. And then really taking every opportunity that I had to try and do these types of services myself. So a lot of times new services might be piloted in certain areas. So always raising your hand and volunteering to be that first person to try something new definitely gives you a leg up on other pharmacists who might not necessarily be as kind of ambitious on what they want to do in their stores. So that was sort of how I moved into this role. And then as far as kind of how we do the wellness days, the pharmacists primarily are the ones who are counseling the patients, but we actually have technicians who perform the point of care test. So the technicians can take a blood pressure, they can take a glucose reading, they can do a cholesterol test. As those results are pending, that gives the pharmacist a chance to start talking to the patient about their health and actually making recommendations. And then we're partnered with the American Diabetes Association to provide some of the handouts and the materials. But there's tons of resources that you can find online just to kind of get those quick and easy handouts to talk about nutrition with a patient.
So how often do you host these events, and how do you measure the outcomes of how they're serving the patients?
So the events are hosted quarterly. We have them usually January, April, July, and September. The outcomes are all measured through basically collecting the information on how many tests we do, how many patients we refer for doctor's visit, and then also just the success stories. So almost every time that we have these events, I have pharmacists that are telling me about how, this patient had a glucose reading of 450 and they had no clue that their blood sugar was elevated. They'd never been diagnosed with diabetes. So they were able to refer them to their primary care physician, and, maybe they sent over a medication right away, which from a functional perspective is, as a pharmacist, we have to walk that line, right? Sometimes we know that medication can be really important and life-saving. If you're a patient who needs to go on insulin because your blood sugar is dangerously high, then that's what we need to do. But knowing and explaining and working with those patients to say, hey, there's things that we can do because we caught this and we were proactive and preventative and trying to, catch it now before it progressed 10 years down the road and you're already having microvascular complications. We can follow up with those patients and continue those conversations and work with their adherence, continue to track how they're doing on their medications, and then continue to provide that point of care testing to see, maybe their glucose is finally starting to come down based on the interventions that we do. And at that point, we can do more of a deprescribing cascade so that we can help patients ultimately get back off the medications, but still obviously shop healthy, which kind of keeps everything going in terms of, not putting yourself out of business, I guess, because that's kind of the question people say. They're like, if you're a pharmacist and you're trying to get people off drugs, isn't that just going to backfire? And then, the answer is no. We want to be able to help more patients. So hopefully by having good outcomes, they'll be more loyal and have family and friends that will trust us with their health in more ways than just filling a pill. So, like I said, medications can be a good thing for acute situations, but if we can work with them on lifestyle, that's really the goal.
So do you see a pattern of like following up with these patients for some time and seeing their outcomes over some time, or like how do you keep track of all of these new people that show up?
Yeah, for a lot of the times when you have those interventions, it can really be life-changing for people. And so they're very thankful and very appreciative of what we've been able to do for them. And they do come back because they want to have that relationship and they want you to be able to help them and be able to celebrate together as they continue on their health journey and get better. So it's definitely kind of that one-on-one relationship development. And I think that really is such an important part of a functional medicine approach, is that patient-provider relationship and really being partners in their health. And so I think that's why pharmacists are just so well equipped to be able to practice a functional medicine approach, because that's what we do. We connect with our patients, we empathize with them, we know all about their family and their dog and, everything else. So it's really kind of just a unique way to continue to follow up with them.
So what does your day-to-day look like as a market wellness coordinator, you said?
Yeah, market health and wellness director.
Mhm.
So my day-to-day in that role really is supporting the pharmacies that are in my area. So it's pharmacy and vision, actually. So I'll spend some time in the stores with, the store management and looking at the OTC department. We'll spend some time in the vision center. We have independent doctors that practice with us, so making sure that their needs are met, and then also working with the opticians to make sure that their business is running well and that they're able to see their patients and provide everything they need. And then spending the rest of the day in the pharmacy. So with pharmacy, it's a lot of different things, whether it's anything from staffing to adherence to specialty medications to immunizations or the wellness days, lots of different things that can be going on at any one point in time. So it's just really making sure that they're supported and they have everything that they need to be successful. So that's the day job. But then obviously I have my other job, which is my Functional Medicine Pharmacists Alliance. So that's just something that continues to grow and continues to be kind of my passion project that I work on any chance that I get. And so it's been really exciting, and I'm really excited to have our new website launching because it's just going to make everything so much more smooth.
So can you tell us a little bit about how that kind of all came together? I know you said you just wanted to keep in touch and network with other functional practicing pharmacists, but how did you make a website? Did you have any support from anybody? And what is your vision for it?
Yeah, so the website is definitely not my strongest suit. I just used a free website builder called Weebly. Um, it was fine for a little while, but it doesn't really have a lot of capabilities to manage members. And as the group continued to grow, like our Facebook group was primarily where everyone communicated. But it's gotten so big now where a lot of people will ask the same questions over and over again. And so it makes it hard to manage that many people. So I have a website developer who's actually helping me build the new website with an actual membership capability and program. So it'll be much better to manage with, basically like having committee options for different initiatives that we want to take on, or having state chapters so that people can meet up with people that are local to them and help kind of advocate for this type of education on a state level.
Wow, sounds amazing. So what kind of gave you the idea or the inspiration for this? And what are your plans for the future besides what you just mentioned?
So The idea for it really was just feeling like there were no resources out there for pharmacists. And, you know, it was something I was just so passionate about and really felt like this is the future that, you know, someone's got to take that first step forward and help introduce this to our fellow practitioners. Another really big motivator was whenever I was doing some of my functional medicine training, I was at a functional medicine conference, and there was about 500 people in this room. 6 of us were pharmacists. We found each other very quickly. But as they were going through one of the slides, it was talking about multidisciplinary teams. So they had like 12 different practitioners on the screen. There was like an acupuncturist and a chiropractor and a MD and a nurse and a social worker and, you know, all of these different practitioners, and there was no pharmacist listed. So I actually went up to the stage and politely reminded them, hey, don't forget about your pharmacists. They're a really integral part of your healthcare team. And they were like, you are totally right. Like, what would we do without our pharmacists? There's so many doctors and practitioners that really rely on the services a pharmacist can provide. But usually in the functional medicine world, they kind of think of pharmacists as just compounding. So we have to definitely work to kind of break that stereotype that we can do more than just compounding, that we're actually providers as well, and able to really help support in those functional medicine teams. So that's where the alliance is really twofold. It's integrating pharmacists into functional medicine, and then also integrating functional medicine into the practice of pharmacy. Because ultimately, we know that there's a lot of challenges in pharmacy right now, whether it's, you know, job shortages and too many pharmacy schools and all these things that we're so worried about. We have to be able to come up with a better way. And that's where I think functional medicine really comes into play. It's something new that pharmacists can do to help our patients and really get out of this, you know, cycle of just prescribing medications and filling medications. It's getting people healthier, it's fixing the healthcare system, and it's providing pharmacists with a new avenue to see patients.
Wow. Well, you touched on a lot of important points there. So how can pharmacists sign up to your site, and what are the benefits of membership right now?
So if you go to fmpha.org, that's the Functional Medicine Pharmacists Alliance, you will be able to sign up very soon. So depending on when this episode airs, we may or may not be fully up and running live. But for right now, definitely sign up for the newsletter. So that way you'll be kind of the first to hear when the new website goes live with the membership. You can also register on the site right now. That basically just ensures that I've got your contact information so that when it goes live, we can import all of our new members. And then there's also a directory feature. So we'll be able to list practitioners who would like to be in that directory so that other patients or pharmacists can find them, even if you're not a full member. So with the membership, we hope to be able to offer a lot more exciting options for people. So one thing that we've been trying to do is more in-person meetups. So I think it's not about adding more things to our calendars, because a lot of times it's too much travel to try and go to every single pharmacy meeting and have to pay to stay and have PTO and all that stuff. So what we're really working to do is partner with other organizations to say, how can functional medicine help your members? So whether it's through an entrepreneurial meetup, we're going to be partnering with the Medipreneurs event. I'll be speaking at that in April. So that could be an opportunity if you're coming to that to learn how to do functional medicine in an entrepreneur type practice. We also have had a meetup with the George Washington University Symposium that's been sponsored by Orthomolecular Products for the last 3 years. So that's something we'll be looking to do in the fall again. And so being able to be a member will enable you to be part of these meetups and to have discounts on some of these registrations. And then also, as we continue to advocate for pharmacists being able to have functional medicine training, working with those organizations, it's really helpful that we have a unified voice. And so being a member helps with the advocacy portion of really carving out our niche in functional medicine as well.
So is it free to join, or is there some membership fee, or maybe you envision it in the future?
So right now it's free to join and say that you're a member. There's not necessarily any other, financial benefit to saying that you're a member other than just, basically having that support and being a supporter in the Alliance. But once we actually have some of these other programs and are putting on more in-person events or webinars or partnering with CE providers, things like that, that's when we'll have an actual membership fee so that you can financially support what we're doing as well, since it's definitely not free to provide all of these services.
Yeah, it's a labor of love, but
Yep.
one must eat as well.
True.
So you're the founding mother, I guess I would say, of this organization. Is there anybody that's helping you right now to develop it further, or is it all based on just your personal vision?
So there's so many pharmacists that as I first started getting into functional medicine, I quickly found we're also in functional medicine. One of the first people was Melody Hartzler. So we went to school at Ohio Northern together. And then when I was still living in Michigan was when I did my very first talk on functional medicine at the Ohio Pharmacists meeting. And she sent me a message and was like, I didn't know you were going to be talking about functional medicine. Like, that's so crazy. That's what I'm doing too. So she was one of the first people that kind of, was there to work with and say like, all right, how do we do this? How do we get the word out about functional medicine? So we've done a couple of CE presentations together. We've also done some webinars together. And then she's actually created fxmedce.com. So functionalmedicinece.com. And had our very first virtual symposium in the fall. So I got to be part of that panel and speak on an introduction to functional medicine and nutrient depletions. So the next one is coming up on February 29th, and that one's going to be all focused on pain management and a functional perspective to managing pain. So you can use the discount code FMPHA for 10% off. And that's just going to be a really exciting opportunity again for pharmacists to not have to travel, but have a virtual option to connect with each other and also have a full day of CE.
Nice. That's beautiful.
Yeah.
So, okay, your vision is to connect functional medicine pharmacists to give them all a unified voice and partner with other organizations and pave the way for the future of pharmacy. Is that correct?
That sounds about right.
Okay, that's grand. So if a person is not formally trained in functional medicine, can they still join? And then how does that all work?
Yeah, absolutely. So the interesting thing about functional medicine is that there's not any one way to do it. There's no one perfect training program that you have to do to call yourself a functional medicine practitioner. That's a very generic term, and there's plenty of people I know who have done zero formal training in functional medicine and are some of the most brilliant people that are out there. So there's so much you can do just through reading online, listening to podcasts, reading blogs, reading books. I mean, almost every major functional medicine practitioner that's out there has probably written a book that you can read and understand so much of what they do and how they built their practice. So I definitely recommend starting there. After that, you can definitely look for different training programs. So kind of the big three are the Institute for Functional Medicine. That's the program that my master's program content was sponsored by. You can start there with their AFMCP. So it's a 5-day course. It kind of gives you a really well-rounded overview of functional medicine. And then it helps you decide if going forward with their full certification program is right for you or not. So it is definitely the largest investment in both time and money, because the way that it's structured right now is that their modules are 5 days. So depending on if you're taking them back to back, there's usually 2 of them that run back to back. You can either do it virtually, but you still have to actually be present for the live videos, or you can do it in person. So obviously being in person is great because you get that experience and that connection. So that's one option. You can also become a member of IFM. So even if you don't go through the training programs, they've got 2 really great 1-hour CE videos that you can watch. And then if you sign up as a member, you get access to the toolkit. So the toolkit has 300 plus resources in it. That's basically everything you would need to actually go ahead and start practicing functional medicine and kind of using these tools with patients. So that's a really, really great option. It'll also get you listed on their directory. So I literally just had a patient call me last week because I was local to him and he found me on their directory. So it's a good thing and a bad thing. If you're not ready for it, they will call you if you have your information out there. The other programs, School of Applied Functional Medicine. Tracy is the founder of that school. A lot of the content I feel is very similar to IFM. The difference is the way that it's structured. So most people take between 7 to 11 months to complete the core semester. And you actually have access to all the information kind of upfront. So they give you a schedule to follow to help keep you on track because it's very immersive. There's also discussion forums, Facebook groups, coaching calls, toolkit of information called the treasure chest. There's a lot of focus on building your practice and actually taking on clients and how to do that. And you can even have a one-on-one session. If you have a client and you're stuck and you don't know where to go or what to do next, they'll actually help you walk through it. So it's definitely more hands-on, and it's something that you go week by week to build on that information versus kind of drinking from the fire hose where it's 5 days all at once and then you don't see anyone for 4 months after that until the next session. So it's a different approach to education. So it kind of depends on what you like, but it's definitely still very motivational and very driven. So they're not going to let you sit back and just kind of take your time reading through the information. Like, you have to get your homework assignments done. And then the third program that a lot of people might do is the Functional Medicine University. So this one is the least expensive of all 3, and it's also, I would say, the most relaxed. So you get access to all of the materials right up front. You can take as long as you would like to go through them. There is no deadline that you have to complete everything by this certain time. There's no schedule of do this module for this month. It's completely self-paced. So if you want to work through it super quickly in just a couple months, you can. If you want to take 2 years and go at your own pace, you can. The other really cool thing is that they offer a 30-day money-back guarantee. So if for whatever reason you start the program and you're like, I don't really feel like this is what I wanted, or, I didn't really learn what I thought I would learn, they are very confident in their program and you can request your money back if you're not happy with it. So there's not really much to lose with that program. And I think it might be a good option for someone who maybe is still working a full-time retail job and they really just kind of want that introduction to functional medicine or a more, self-paced kind of overview. It could be a good option there versus someone doing SAFM that's really trying to build a practice, or someone doing IFM that wants that gold standard, is ready to, like I said, baptism by fire in the way that they teach. So lots of different options out there, and it just depends on what works for you.
So it sounds like you're very familiar with all 3 of these programs. Did you kind of dabble in all of them, or did
Yes.
you finish all of them?
So the IFM content is basically what was taught through my master's program, and then I did the AFMCP program for one of my electives. So I haven't done the rest of the modules yet, mostly because of the time commitment. So taking, my PTO time that I only get 3 weeks of in a year to spend doing more functional medicine CE is kind of hard for me right now. So in the future, I hope to be able to do them. And then the SAFM and the FMU programs, I'm actually doing both of them head-to-head right now for comparison purposes. So it's a little easier for me because I've already done functional medicine training. So it's not like I'm having to learn it all for the first time, it's kind of fun because it's like a refresher and I get to compare them very objectively to say like, okay, I've already learned, most of this information. So now how do these two schools teach? What's different? What's similar? And hopefully at the end of it, that'll be something I can provide through the website, is more individualized consultations for people who are trying to find their journey in functional medicine. So having kind of that coaching program to help people on their journey. So it's definitely the biggest question that we get.
Yeah. So when you signed up to be part of the directory for the IFM and that person contacted you, does that mean you're also offering one-on-one consultation directly to clients?
So I do. It's just not something that I really advertise very much. But yes, I use a software called Practice Better. It's essentially tailored for nutrition consultation. So it's HIPAA secure, the payment portals are secure, they can fill out all their health history information on there, and then I'm able to provide recommendations for them. So
Nice.
yeah.
Awesome. So you kind of mentioned something while you were talking, so I'm going to challenge you a little bit. I have a question for you. If we had the perfect medical system, how might it look?
So in a perfect medical system, I think that patients would truly be able to have that proactive and preventative approach to their healthcare, where it would be much easier to connect with their practitioners, and that practitioners would be more like a guide for them. It would take away that kind of paternalistic model where, your doctor tells you exactly what you're going to do and there's no questions asked. It would really be more of a partnership. Obviously, as a pharmacist, I think our role would be more expanded and we'd be seen more like a mid-level practitioner alongside a nurse practitioner or a PA, and kind of serve in that same capacity where anytime a patient's on any medication, they have an appointment with the pharmacist. So I think that's something that most providers would very easily be able to just take off their plate rather than having to mess around with figuring out dosing and rewriting prescriptions and all the back and forth that goes on between pharmacists and providers right now. There's pros and cons because there's checks and balances there. But generally speaking, I think 9 times out of 10, if the pharmacist was able to make those decisions in the first place, we probably wouldn't have so much of the back and forth that happens. So I really think that's where pharmacists could kind of excel and take a bigger role in the healthcare system. And then, of course, having a more functional medicine approach and making sure that it's more accessible, especially in terms of, labs and things like that. I see more of that being direct to consumer. So really, it's not about, having to go and see a physician. It's really making that personal information about your own health available to people, and then being able to help them interpret, what does this mean? What can I do with this information to change and improve my health?
I love that. Thank you. And I would have to add the accessibility part. I think there should also be accessible by price points, remedies that people can take, let's say if they don't have insurance, or, like a lot of the pricing of the expensive medication is what is preventing somebody from taking something that their doctor recommended, let's say, versus something that's actually covered by the plan. There's a lot of back and forth that goes between
Mm-hmm.
medication and the practitioner and the pharmacy and the doctor and the insurance plan. So like all of that
Yeah.
needs to be made more accessible, I think, where everybody kind of understands that we're trying to do the best by the patient. And I see it as a do no harm kind of thing, starting from the little things and non-pharmacological approach first, as we were taught, and then bringing out like the big guns later on, rather than just like
Mm-hmm.
throwing everything at this patient and expecting them not to be overwhelmed.
Yeah, absolutely. And I didn't even really touch on like the whole PBM situation and all of
Right.
that. Like that would just be gone. They would just not even exist. Because obviously we know that that creates so many problems and, you know, unfairness in our medical system and just drives up the cost. So, yeah, that would definitely be another really big change for sure.
Yeah.
And I think the other piece of it too is the food system
Hmm.
is almost as corrupt, if not more so, than the PBM system.
Yeah.
So there's a lot that needs to change with that. Obviously, Dr. Mark Hyman's writing a book called Food Fix, and it addresses all of these issues of how, you know, a lot of times our food systems create poverty and create inequities in health. Whenever healthy food deserts are out there and patients can't get access to foods that would be better for them, and then it just perpetuates that cycle of poor health outcomes, low income areas, and really that, you know, selective discrimination in a way that unfortunately impacts certain health populations more than others. So that's a definitely a whole nother realm of, you
Absolutely.
know, things that we could talk about.
Yeah. I mean, the way the food is grown, the way the food is transported, stored, and preserved, the way the environment, is impacted by all these things, the way our lifestyle, how stressed we all are. So it just all ties in together in that holistic health. There's so many components. Just one part of it is medication, which is the part that pharmacists are really, take center stage on. But I think they're very important to maintaining one's health. All of these things have to be considered.
Absolutely.
So, what is your advice to other pharmacists or perhaps students that are just starting out in pharmacy and people that are interested in functional medicine? What do you think they could go and do?
Oh man, students, that they're the next generation, right? I remember being a pharmacy student and being so excited to get out there and practice. Stay involved, and if you're interested in functional medicine, get involved with FMPHA right now. That is probably one of our biggest agenda items this year is to really work to get functional medicine taught in pharmacy schools. So there's a handful of professors out there right now who are doing lectures on functional medicine or kind of weaving it into their curriculum where they can, or maybe doing an elective on it. But you know, my goal would be to see functional medicine actually become part of the standards of education, that all pharmacists are taught more about lifestyle, taught more about nutrition. You know, these are very fundamental things that we should be able to help patients with. And a lot of times we just don't get the education that we need. So I think if schools are really serious about equipping their students with the next set of skills that patients need to manage chronic disease, that they should be looking to functional medicine. You know, pharmacogenomics, things like that, those are starting to be integrated into the curriculums a lot more. I think that's another aspect that can be utilized by someone with a functional medicine approach. But there's just so much that we could be doing to help prepare our students to really help improve outcomes. So that's a huge goal, to try and get more education on functional medicine in schools. We're also looking at if we would be able to even create a specialty in functional medicine for pharmacists. Like I said, there's a lot of training and certification programs out there, but there's not really any that's specific to pharmacy. So we have the BPS, exams that you can take. So that would be another kind of long-term goal, is to be able to have functional medicine that widely recognized that you can be certified in it through that organization. Um, but for other pharmacists who are just trying to figure out, you know, where do I start? Where do I get involved? Like I said, start educating yourself on it. Start taking some of these, you know, supplements, or changing your diet, or experimenting in your own health so that you can help your own self be healthier. I really think that once you experience health as a vitality and not just the absence of disease, you'll really start to understand it. I know for me, when I discovered functional medicine, like I said, I thought that we were doing everything right. Like I thought we're eating the whole grain bread and we're drinking the skim milk and, you know, all those things that we thought were healthy. And it turns out were really toxic for my husband and I, not being able to tolerate them. And then once you remove those offending things and you start replacing them with the actual nutrients that you need, you just feel so much different. So sometimes you don't realize how bad you feel until you actually feel normal, and normal feels really good. So that's where I say start with yourself, especially since there's a lot of concern about pharmacists' well-being and resiliency and all of that. And so kind of looking inward and making those changes so that you can be your best self will help you be able to identify ways to help your patients as well.
Awesome. Yeah, I'd also love to see more courses for pharmacists in terms of lab interpretations. I think that would be very helpful.
Yep.
And so the CE courses that you mentioned, are they going to be both as a CE for functional medicine practitioners and for pharmacist requirements, or how do you envision those working?
So, like for the functionalmedicineCE.com, the virtual symposium, those are pharmacist CE right now. And then I believe they also got accredited for nutrition CE. And then we've had tons of people that are asking, hey, is this going to have medical CE and chiropractor CE and nursing CE? And so it's kind of interesting because now that, Melody is providing this amazing education at such a fair price, everyone else is wanting to get on board too. So it's like the way I see it is hopefully we can all learn together, and organizations that are providing functional medicine education will be able to provide CE for anyone. So it takes, again, more time and money to be able to provide that CE certification. But hopefully as everything grows, the more people that get involved, there's a better ROI to actually make it available as CE for all different practitioners.
Yeah, I love the idea of making functional medicine as a specialty for pharmacists, because then we can get those CEs, or even like nurses and other medical healthcare team members can specialize in this and then take those kind of CEs as part of their specialty.
Mm-hmm.
So I love that. So we have just a couple minutes left, and I want to ask you just a couple of rapid fire questions if you're up for them.
Of course.
Okay, so the number one thing listeners can do right now to improve their quality of life.
Deep breathing.
Love that. Short and sweet.
Yep.
Okay, what is your hobby or favorite pastime?
I ride a 2017 Harley Davidson Lowrider S.
Wow.
Yep,
That's a nice trivia piece right there.
it is.
What's your favorite beverage to drink?
I love sparkling water.
Sparkling water, that's a favorite too. And lastly, I want to thank you for your time, and I want you to please tell our listeners how they can get in touch with you or learn more about all the programs that you mentioned.
So lots of ways you can find me online. Personally, it's at Dr. Lauren Castle on LinkedIn, Instagram, Facebook. And then you can find me at fmpha.org, as well as on LinkedIn, Facebook, and Instagram at fmpha.
Awesome. So I'll include all those links in the show notes. And again, thank you, Dr. Lauren Castle, for your time and for this wonderful podcast episode. And I hope to speak to you soon and keep in touch with all your wonderful additions to your website.
Thank you.
Bye. Have a good night.
Bye.